Hi, my name is Alec Cook, and this is Youth-Centered Practice, a toolkit for service providers from Minds of London Middlesex. The Mental Health Incubator for Disruptive Solutions, Minds of London Middlesex, is a social innovation lab focused on developing disruptive solutions to promote the mental health and emotional well-being of transitional age youth in our community. Interventions focus on developing and supporting innovative solutions that explore the need for systems-level change with an emphasis on the educational and mental health care context. Youth-centered practice was created and developed utilizing Youth Participatory Action Research, YPAR. YPAR as a framework is focused on engaging both youth and adults within a community to work alongside one another in a non-hierarchical format, creating and encouraging change in current system structures to provide benefit to the entire community. As a Minds of London Middlesex intervention, YCP uses YPAR to engage youth in a meaningful and impactful manner. A youth-led intervention, youth act as co-researchers and are involved with leading all components of the research process, from describing the issue to developing and testing the efficacy and impact of YCP. Appreciative inquiry focuses on the ways in which people interact with their social world and how those interactions sustain their relationships which they engage in. In interviews conducted by members of the Minds of London Middlesex team, an appreciative inquiry approach was used to ask youth and their families about their experience interacting with the mental health care system in London Middlesex and about positive and negative contributors to youth mental health. The appreciative inquiry approach revealed two key findings: that youth and their caregivers reported feeling that some healthcare professionals were disingenuous and felt that their voices were not being heard by all members of their care team, and that child and youth care workers, CYCs, were identified as being allies to the youth in their journey through the mental health care system. The youth reported their relationship with the CYCs as contributing positively to their mental health. From these findings, it was concluded that both youth and their families preferred a whole person or youth-centered approach when interacting with service providers. The Youth-Centered Practice YCP project is a youth-led intervention which aims to bridge the gaps in relationships between youth and mental health care professionals who serve them. The project's goal is to translate the tacit knowledge of experienced mental health care providers for the purpose of developing an operationalized definition of what constitutes a YCP in mental health care, and further utilizing this information to create and pilot training for service providers on being youth-centered. To better understand what it means for a service provider to be youth-centered, Minds interviewed service providers in London Middlesex. Participants were previously identified by members of the Minds team as already practicing youth-centeredness. 14 mental health care professionals, 8 service providers, and 6 senior students from Fanshawe College's Child and Youth Care program were interviewed. Participants were asked questions relating to how they practice being youth-centered and what steps they took to become youth-centered. A qualitative synthesis was produced from these interviews, and 5 themes and 14 subthemes were identified. The themes of YCP. Theme number 1, relationships, with the subthemes humanity/individualized, trust, openness/therapeutic alliance. Theme number 2, accessibility, with the subthemes recognizing and removing barriers, and physical space. Theme number 3, with the subthemes youth engagement and care planning, sharing power, and choice/facilitating agency. Theme number 4, with the subthemes self-reflections/similar to affecting change in youth, setting boundaries, proper communication, and modeling how they want practitioners to interact with youth. The final theme, theme number 5, importance of YCP, with the subthemes youth-centered practice as a teachable concept and prioritizing the youth. A quote from one of the participants: "We, as clinicians, find joy in helping young people get better. And it's incredibly rewarding because young people do get better. They do. They are in a developmental stage where they can just blossom into, fantastic, wonderful human beings from having felt very defeated and so undone by their mental health concerns." Youth-centeredness currently exists as tacit knowledge that only some service providers can access in the current child and youth mental health care system. Minds is currently developing a youth-centered practice toolkit that will deliver a curriculum derived from the themes of YCP explored in the qualitative synthesis. The toolkit, as a part of the Youth-Centered Practice Project, seeks to improve mental health care outcomes for youth by training service providers in youth-centeredness, thereby enabling them to form more meaningful and supportive relationships with the youth that they serve. The expected completion of the Youth-Centered Practice Project is fall 2021. Thank you for looking over my poster. For more information, please visit the Minds of London Middlesex website. Thank you.